Have you noticed any purple, dark, or strange stain suddenly appearing in the skin of an elderly man in your family? Most people think this is just another common sign of old age. But what if I told you it can be a silent warning that the body is starting to turn off? Few recognize this sign in time, and unfortunately, many perceive only when it is too late. The body warns, the skin shows, but almost no one can interpret. These discrete spots, often ignored by children, grandchildren, and even caregivers, may be revealing that something much more serious is happening within the elderly organism. Did you know that before organ failure, the body sends external signs that manifest themselves mainly on the skin? This is not conspiracy theory. It is science. It is biology. It is the cycle of life. What is most impressive is that even though it is a clear visual signal, it is often neglected. People think, oh, it must have hit somewhere, or it's just another spot, the age of age. And then time goes by. And with him, a unique opportunity to act, to take care, to prepare, get lost. Just imagine, you are taking care of your father, your grandfather, or even a dear patient. One day you notice a darkened stain on the legs, arms, or back. It sounds harmless, but it is not. It may indicate severe circulatory problems, sudden drop in pressure, or even the beginning of a system of systemic failure, a common condition in advanced stages of chronic diseases or at the end of life. It is a silent sign, but he shouts to who knows how to hear. And do you know why this type of content is so important? Because no one tells you that in quick medical appointments. No one prepares you to observe the real signs of decline in the elderly. Most families find out the worst way when there is no longer much to do. But here you will learn to see before. You will understand what the skin is trying to say. These changes in color, especially when they appear in areas such as feet, ankles, hands, or back, may indicate a reduction in blood flow, something common in the terminal phases of life, but it may also be an early warning, a chance to investigate, and perhaps reverse or relieve a picture of future suffering. Can you understand the power of it? Knowing how to identify this signal can give you days, weeks, or even months more with those you love. It may be the difference between a hasty goodbye and a goodbye in peace. And I ask you now, have you seen something like someone in your family? Have you noticed any stain that appeared out of nowhere and then disappeared? Or worse, did you ignore thinking it was nothing? If so, this video was made for you. And even if you haven't gone through it yet, knowing this today can completely change the way you take care of those who are getting older around you. Stay with me until the end, because in the next stretch, I will reveal you what exactly causes these blemishes, why they come up, and most importantly, what you should do when you notice that sign. This is where a lot of people make a mistake and regret for the rest of their lives. So before we continue and I show you why these spots appear and what they really mean in the body of an elderly man, I want to ask you something very simple, but very important. If at some point in your life you've seen a strange spot in the skin of someone older, or if you've been through this experience of following a loved one at the end of your life, share it here in the comments. It may seem like just one report, but it can help other people recognize the signs as well. What's more, when you comment, YouTube understands that this subject is relevant and shows this video to more people who also need to know it urgently. Also enjoy and already leave your like. This simple gesture helps too much to spread this information, which, let's be honest, very few people have access. How many times have you seen a doctor explaining this clearly? How many times has anyone warned you to a symptom that can be the last request for relief in the body? And if you are new here or have not subscribed to the channel, click the subscribe button now. Here, we talk straight, without winding, about what really matters to the health of those we love, especially our elderly, who often suffer silent, without anyone noticing. So if you care about the health of your parents, grandparents, or even your own future, stay with me until the end, because now we will dive deep into the explanation of what is behind these blemishes and why they are so dangerous when they appear for no apparent reason. You will understand how the body warns us and how to be aware it can change everything. We are talking about something that, at first glance, seems harmless. A spot on the skin, a purplish or darkened tone, sometimes with an irregular contour, appearing in the arms, on the legs, or even on the back of an elderly. A lot of people look and think, it must have hit somewhere, or age, it's normal. But what if I tell you that this can be one of the last visible signs that the body is collapsing silently? This is a warning that the skin gives when the blood flow begins to fail, when the organs begin to receive less oxygen, less nutrients, and gradually begin to turn off. Few know this because almost no one talks about it. Not every health professional warns families, and many caregivers were not trained to observe this type of symptom. But the science of palliative care, the one that studies the finitude process in depth, clearly shows that these skin spots are linked to a reduction in peripheral perfusion. Eye blood no longer comes with the same strength and frequency at the ends of the body. This is because in situations of progressive bankruptcy, either by chronic diseases, extreme aging, or multiple health problems, the body now preserves vital organs such as the heart and brain, reducing circulation in less priority regions such as legs, arms, and skin. And that's where the body begins to warn from the outside what is happening inside. Those spots, which many think are common bruises, can be life, accumulation of blood under the skin caused by this low circulatory flow. And they do not appear by chance. They are saying something. They are asking for attention. They are often indicating that the person is entering a stage where each gesture of care matters even more. And you may be wondering, but why does this happen to some elderly and not with others? The answer lies in a combination of factors: genetics, pre-existing conditions, silent diseases such as heart failure, kidney problems, uncontacted diabetes, chronic lung diseases, and also in life habits that one has had over the years. An elderly man who has spent a lifetime sedentary, with poor diet, little preventive health control, and accumulated stress, for example, is more likely to have a faster systemic decline. In addition, the old age is already a challenge for the body. Over the years, blood vessels lose elasticity, the defense system gets slower, and cellular regeneration no longer happens. The body ages inside, but gives signs on the outside. The skin, being the largest organ in the human body, becomes one of the first mirrors of what is happening behind the scenes. And that's where the danger of ignoring this sign lives. Because while you think it's just an ordinary spot, time is passing and the body is trying to communicate that you need help, that is overloaded, that is reaching the limit. In some situations, these spots are accompanied by other signs, such as cold skin at the ends, swelling, extreme weakness, mental confusion, or even fall in blood pressure. And when all this appears together, the picture can be much more serious than it seems. The most worrying thing is that many of these spots do not hurt, do not score, do not bother. That's why they go unnoticed. They do not draw attention for the discomfort, but for the appearance. And if you don't know what to observe, you may never realize what is really happening. This is why this knowledge can be the difference between regret and action. You can give you a chance to anticipate, to take better care, to ensure comfort, and even talk to doctors to seek ways that respect the dignity of that elderly. Now imagine a real scene. A son arrives to visit his 83-year-old father. Look at his leg and sees a dark, half-purple, well-marked close spot near the ankle. Ask what it is, and the father says he must have hit the bed. But in the following days, the stain does not disappear, and others arise. In silence, without pain, without bleeding, but they increase. This son, if he knows what we are talking about here, will seek medical advice, will investigate, it will prepare, it will avoid being caught by surprise. Now, if he doesn't know, maybe you will only understand gravity when there is no more time to act. Do you now realize the importance of observing the small signs? And how much is this linked to our mission to carefully care, empathy, and information? This is why videos like this are fundamental, because within minutes, you have access to information that can save a life or at least give more dignity to the end of it. And if you are watching here, it is because you care. You are seeking to know more. And this is already the first step in becoming a person who makes a difference in the lives of those who are getting older around them. Skin health, especially in the elderly, is a direct reflection of the functioning of internal systems. Sudden changes in color, appearance of strange spots, cold areas to touch, all of which should be investigated. From now on, you will no longer look at a stain the same way. You will understand that each change has a reason, and that the skin can be the body's last communication channel with the outside world. Knowing how to interpret this is an act of care, love, and responsibility. And I want to ask you a favor now. If this content is making sense to you, if you have touched you in any way, leave it here in the comments. Have you seen this kind of stain on someone in your family? Have you gone through a situation where only then did you realize that this sign was serious? Put here, "I've seen this sign," or "Now I understand." Your comment may not only strengthen this video, but also help other people understand that they are not alone. With time, the human body goes through a series of silent transformations, almost imperceptible in everyday life. But they are there, happening slowly, as if the body was preparing to slow down. Each decade lived, tissues lose elasticity, muscles lose strength, and especially the circulatory system begins to face limitations. The blood, which in a young person flows with sufficient pressure, agility, and volume to irrigate each cell with oxygen and nutrients, now circulates with more difficulty. And that's exactly where the detail lives that almost no one notices. When you see a dark spot appearing in the skin of the elderly, what is actually happening inside is much more complex than it seems. The skin, which is already naturally thinner and fragile with aging, begins to highlight low oxygenation, stagnant blood accumulation, collapses in small vessels, which no longer have the strength to remain righteous. These small hair vessels break easily, especially at the ends: hands, feet, ankles, calves, arms, and even on the back. This is because the body, in an advanced state of wear, now redistribute energy, oxygen, and nutrients with priority for vital organs such as the heart, kidneys, liver, and brain. This is natural. It is as if the organism, realizing that resources are scarce, makes strategic decisions to keep the essentials working longer. This redistribution of blood flow means that the most distant regions of the heart, such as the ends of the body, are no longer a priority. Blood comes to come with less intensity, lower volume, and this leaves cold skin, marbled, purplish, or gray. This is why at these times the spots appear. They are an external reflex of an internal circulatory collapse. The purplish, sometimes greenish color is the result of stopped blood, poorly oxygenated, stuck in vessels that are no longer being drained efficiently. The body is already working in emergency mode. And what a lot of people don't understand, and now you'll know, is that these blemishes are not simple bruises as many think. They do not appear from beats, do not come from falls. They are called liver, and are directly related to the beginning of a process of peripheral failure. The skin no longer receives the same metabolic support, and this is a silent but extremely important alert. Most people who have had a situation of care for an elderly man in the terminal phase, when he understands that, begins to see the body with other eyes. It begins to interpret the signs in a much deeper and more careful way. It is also important to understand that this redistribution of the flow does not happen overnight. The body gives progressive signs. First, there is a slight decrease in circulation, then a drop in blood pressure. The heart begins to beat slower or less efficiently, and when the pressure drops, the blood cannot rise to higher enough regions. It is at this point that the elderly begins to present extreme tiredness, unusual drowsiness, difficulty keeping their eyes open, hands and cold feet, even in hot environments. And then the spots appear. They are like a red card of the body, signaling that it is entering a critical state. In this whole process, another factor that aggravates the situation is hair fragility, very common in elderly with diseases such as diabetes, hypertension, renal or liver failure. These clinical frameworks further compromise microcirculation, making the blood stuck in the tissues, unable to be absorbed back through the lymphatic or circulatory system. The result of this is visible: spots that increase over the days, which change color, that take irregular shapes, and are often accompanied by other signs such as edema in the legs, difficulty urinating, mild mental confusion, or even nightly delusions. And if all this seems very technical, take a deep breath, because I will explain to you from a very simple way. The human body is like a city, and the blood, like traffic. When everything works well, traffic flows, the streets are free, the traffic lights are synchronized, and each neighborhood receives what it needs. But when energy is missing, the city needs to cut spending, and then the most distant neighborhoods of the center are greeted less attention. Traffic diminishes, the signs go out, and the movement too. The periphery suffers first. With the body is the same thing. The central organs continue to function while arms, legs, feet, and hands start to turn off. The skin warns, blood flow decreases, and the spots appear like plates saying, "Attention, we're closing here." This kind of knowledge is not common. And honestly, it should be taught from an early age, especially for those who take care of parents, grandparents, uncles, or elderly in general. Knowing how to recognize these signs not only allows acting faster, but also with more empathy. It is possible to welcome, talk to health professionals, adjust palliative care, and even prepare the family emotionally for what can come. This is not being pessimistic. This is a human being. It is understanding that we will all one day go through this directly or indirectly, but beware. Not every stain means imminent death. Some may be caused by anticoagulant medications, light trauma, or allergic reactions. Therefore, it is always essential to observe the set of symptoms, the health context of that person, and of course seek specialized medical advice. But here, what we are showing you is a pattern that many people ignore, and it is by ignoring that many are caught by surprise. Sorry for not looking better. Listen to more, hugged before. Now that you know that these spots are much more than superficial brands, that they represent a deep sign of the body, I want to make you an important invitation. If this content is opening your eyes in any way, if you are helping you better understand the natural process of aging and health of the elderly, leave your comment below. He writes, "Now I understand better," or "I've been through this with someone in my family." Your comments help others not to feel alone, and they help this video reach those who need this urgent information. It also takes advantage of this video with someone who takes care of an elderly man, with that relative who lives saying that stain is normal, with the friend who is going through this and still does not know what to do. To understand this kind of stain on the skin of an elderly man, especially if it appears suddenly, without history of beats or bruised, and even more if accompanied by symptoms such as unusual, swelling, excessive fondness, or feet hands, difficulty breathing, or even episodes of fainting, the first step is not to ignore. Do not expect time to solve by itself. The immediate reaction should be 1. Seek medical attention as soon as possible. And here, when I say fast, it's really fast, because this may be the only time you have to intervene, talk to the health team, adjust medications, request tests, and offer more assertive care. A lot of people waste this precious time hoping that will pass, that tomorrow improves. But the elderly body no longer works with the same before regeneration capacity. That waiting that could be harmless in a young adult can be fatal to an older person. An elderly organism responds differently to changes in pressure, circulation, temperature, and metabolism. The skin, as we explained, shows these signs visibly, and when the skin screams, it is because the body has been trying to balance inside for some time. The appearance of darkened spots, especially at the ends, may be the beginning of peripheral bankruptcy, a condition called hypoperfusion, where blood no longer circulates hard enough to nourish tissues. Now pay attention to something fundamental. Not every stain means that the person is dying. This needs to be said clearly. There are situations where these spots appear for less serious reasons. A new medication, for example, especially anticoagulants, can cause internal bleeding and spontaneous bruising. Prolonged use of corticosteroids weakens the vessels of the skin. Diabetes, in turn, alters microcirculation and can cause skin color changes. But in all these cases, even if the reason is not terminal, the warning should be the same, because the elderly body no longer has the same safety margin as before. Each small change can be the beginning of something bigger. Therefore, every signal deserves attention, investigation, and follow-up. Noticing the blemishes besides looking for the doctor, observe other subtle signs. Are you eating normally? Are you urinating regularly? Are you interacting as usual? How is the level of attention, speech, balance when walking? This information helps the health professional understand the context and make a more accurate diagnosis. In many cases, the doctor will request blood tests to verify infections, coagulation changes, renal, liver, and cardiac function. It may be necessary to make an electrocardiogram, a blood pressure assessment, and in some cases, a tomography or ultrasound to verify if there is any internal bleeding or silent organic dysfunction. Another essential step, and here comes something few say, is communication between family and medical team. When you go to the emergency room or the office and report that strange spots on my father's skin, without details, the team often does not pay due attention. But when you say, the spots appeared out of nowhere, he's weaker, confused, with cold feet, and is sleeping all day, it completely changes the team's gaze. It is necessary to describe, detail, to give context, because only then can professionals prioritize and conduct the correct exams. And if it is detected that the picture is more serious, that there is a process of progressive bankruptcy happening, this is the time to think of comfort, welcome, and respect. It is no use forcing invasive examinations, traumatic hospitalizations, or aggressive therapies that will only prolong suffering without providing quality of life. At these times, the importance of palliative care comes into play. Taking care is not just healing. To take care is that person is well assisted, without pain, without discomfort, with emotional support, and with dignity to the end. And you see, this is not only true for those in terminal phase, but also for situations where the body already gives signs of extreme fragility. Many elderly spend years in this condition of permanent alert, where any fall, infection, or dehydration can trigger a collapse. If you start paying attention to these signs in advance, prepare yourself better, avoid hasty decisions, and can offer a quieter routine to those who love. Did you know, for example, that the simple act of lifting your legs, improving hydration, and adjusting food can help relieve swelling and improve peripheral circulation? In many cases, the use of compression socks, under medical advice, small daily walks, light massages with vegetable oils, and warm baths help reactivate tissue flow and reduce the incidence of these spots. But all this should be done with guidance, because each body is unique and each clinical history requires a different conduct. Another important thing, if you are a caregiver, familiar, or directly responsible for an elderly, record these changes. Take pictures of the blemishes, write down the day they appeared, the location, whether they increased or diminished, whether there was itching, pain, heat, or any other symptom. This organization makes all the difference when it comes to following the case and showing the evolution to the professionals. In emergency care, this information is precious, and don't fall into the trap of thinking that if you're not feeling pain, then it's not serious. Many seniors, even in the face of serious paintings, do not verbalize pain clearly, whether because of cognitive changes, ashamed, fear of worrying about the family, or simply because they are used to withstanding discomfort. Pain is not the only alert sign. Change in behavior, weakness, distant look, diminishing speech all may indicate that something more serious is happening. And if at that moment you are remembering someone you take care of, who lives with you, or even a distant familiar who may be showing these signs, I invite you not to let it pass. Do not expect the situation to get worse to act. Be proactive. Talk to the person, with other family members, with caregivers. Organize a trip to the doctor, and if possible, go together. Ask, question, write down. This is your chance to make a difference, of being real present. Now, if you are watching this video here, I want to know, have you seen a strange spot in the skin of someone you know? Have you ever been to the situation of seeing these signs and not knowing what to do? Or maybe you already lost someone. And then did you understand that the body was giving warnings that no one knew how to read? Write here in the comments, "Now I know what to do," or "I've seen that sign and ignored it." Your experience can inspire other people. You can even save someone. If you stayed with me here, first I want to thank you from the heart. This shows that you really care about the health and life of the people you love. And if this content made sense to you, now it's your turn to act. Take advantage of this moment and subscribe to the channel, because here you will find many other videos that will help you better understand the signals of the body, especially in the care of the elderly. Your registration does all the difference for us to continue bringing this kind of information to more people. And if you arrived until the end, comment below, "Now I see differently." This shows me that you have absorbed the content and also help YouTube spread this video for those who need it. Don't forget to leave your like too. If this video touched you, taught you something, or brought you clarity, click on the thumbs up now. It helps too much to strengthen this channel and keep that work alive. And to keep learning, just click on the next video that is appearing on your screen now. I wait for you with more important information, straight to the point as always. Until now.